you. Hi Kayla, I'm going to be doing an assessment on you. I'm just going to start by looking at the symmetry of your face. Looks good. Expecting. Good. I'm just going to go ahead and look through your hair. Okay. Let's go through and seeing for any lice or redness or flakiness. And palpate your head, your skull, feeling to make sure there's no deformities. Very good. And now I would just like to have you go ahead and smile. Go ahead and puff out your cheeks, frown, and go ahead and raise your eyebrows up and close your eyes nice and tight. That's just checking your cranial nerve number 7. Okay. Now I'm going to check your sensation on that face. This is going to check your cranial nerve number 5. You see your hand? This is going to be sharp and this is going to be dull. Okay? So just tell me whether it's sharp or dull. I'm going to poke around your face.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Very good. Okay. Now I'm going to palpate these your temporal arteries just to feel anything, any tenderness. Nope. I'm just going to listen with the valve of my stethoscope. Looking good there. Okay. I'm going to now move on to your eyes. I'm going to check your visual acuity, your cranial nerve number 2. I'm going to have you stand up. Have you stand right here. I'm going to have you hold this card. Cover your eyes 6 feet away. And then I'm going to have you read the lowest that you can on this chart, okay?
LTFPH.
Very good. And now cover your other eye. And then I'm going to have you read it from right to left as low as you can.
HPFTL.
Very good. 20/20 vision. Okay. Next, I'm going to just look at your symmetry of your eyes and everything. Make sure that they're where they're supposed to be. I draw a line from this to your ear. It looks good. Your ear's above it. And then I'm also going to look at your the white of your eyes, the sclera. Go ahead and raise your eyebrows all the way, your eyes all the way up. Good. Pull down. Look under your eyes as well. Good. I'm going to look at your tear ducts. Those look good. Very good. I'm going to check out your cornea, so just look straight for me. Just checking to make sure it looks clear. Very good. Next thing I'm going to do is I'm going to see how your eyes, how your pupils dilate, okay? So go ahead and look straight ahead, and I'm going to shine this light into your eyes. Very good. Very good. Next, what I'm going to have you do is I'm going to have you fix your eyes on the chair that's across the room, and then I'm going to have you look at me. I'm going to watch to see what your eyes do, okay? Just go ahead and look at me. Good. Very good. And next, I'm going to check your muscles, your cranial your eye muscles, number 3, your cranial nerves, number 3, 4, and 6. Okay, so what I'm going to do is I'm going to hold your chin, just as a reminder, and you're just going to follow my finger with your eyes, okay? Down. Very good. Other way. Very good. And now I'm going to bring it all the way to your left. Very good. All the way to your right. Very good. And now I'm going to bring it straight up. Straight down. Good. Can you close your eyelids for me? Good. Eyelids look good and everything. Good. And hair and everything looks good around your eyes. Your eyelashes curve up as they should on the top, and they curve down on the bottom as they should. The next thing I want to move to is look inside your eyes. So I'm gonna shine this light, okay? And I want you just to kind of look straight ahead, look right in your eyes. Very good. Do the other one. Very good. Everything looks good. Next, we're going to move to your ears. Okay, so I'm just going to take a look at your ears, symmetry, and everything. Good. Good. And I'm just going to palpate around here. Good. Palpate back here. Your mastoid bone. That's what it's called. Very good. No drainage or discharge. Redness. Looks good. Next, I'm going to do a whisper test. It's going to check your cranial nerve number 8. Okay, so I'm going to stand about 3 feet behind you. I'm going to have you put a finger in your ear and wiggle it, and then I'm going to whisper letters or numbers, and then I'm going to whisper 3 of them, and I'll ask you to repeat it back to me. Okay, so go ahead and put your finger in your ear.
A85.
Very good. I'm going to have you do it the other ear.
276.
Very good. Very good. I'm gonna take a look in your ears now. You come over here, and I'm just gonna pull up on your ear, pull up and back, and take a look. Looks good in there. Pearly gray as it should be. To make my brain. And then I'm gonna pull up and back on here. And look at this guy. Looks good as well. Okay. I'm also going to do what's called a Weber and Rhine test. So I'm going to strike this tuning fork and I'll place on top of your head, and then you tell me if you hear it in your right or left ear or both equally in both ears, okay?
Both.
Very good. Next I'm going to do the Rhine test. This is going to test your bone conduction right here, and then how your ears hear from air. So I'm going to put it on your bone. When you can no longer hear it, tell me, and then I'll move it close to your ear, okay?
Okay.
I'm just gonna move this out of the way.
It stopped. It stopped.
Very good. I'm gonna do it on the other side now. I would do that one. Stand right here.
It stopped.
Very good.
Stopped.
Very good. Airway conduction is twice as long as bone conduction, which is good. Next, what we're going to do is we are going to move on to your nose. Okay, so just looking at your external nose, making sure it's symmetrical. No nares look equal. When you're breathing, don't look like you're in distress at all. That's good. Now I'm just going to look inside your nose. Okay, go ahead and tilt your head back just a little bit. Very good. Septum and what are called your turbinates all look good up there. Looks like it's all straight. And very good. Looks good. Okay. Next, we are going to look at your sinuses. So I just want to feel your frontal sinuses. Tell me if you have any pain. I'm pressing right here.
Nope.
Okay. And these are called your maxillary sinuses. And have any pain when I press right here?
No.
Okay. Very good. Now let's move on to your mouth, okay? So I'm going to have you clench your teeth. And go on and open them, clench them nice and wide so I can see your teeth. Good. Very good. Look like they stay in line like they should. I'm going to have you open up your mouth, and I'm going to use a tongue depressor to kind of look at your gums and everything in there, okay? So go ahead and open. Looks good. Very good. Good. And now I'm going to have you stick out your tongue. And this is going to check your cranial nerve number 11. Very good. And then I'm going to look on the sides of your tongue as well. Those look good. Go ahead and move your tongue over the other way, please. And now I want you to bring your tongue to the top of your teeth. I can look underneath of it. Good. And then I'm going to have you open up your mouth nice and wide and say ah. Good. Your uvula goes up as it should, checking your cranial nerve number 10. And that looks good. And then now let's look at your joints right here. Go ahead and open up your mouth. Go ahead and close it. And just feeling up through here. This is also checking your cranial nerve number 5. Okay. Now let's move on to your lymph nodes. I'm gonna palpate your lymph nodes now. I'm gonna start back here on your occipital lymph nodes and palpate those. Your posterior lymph nodes. Good, just pressing nice and soft to try to feel them. Your preauricular lymph nodes, and then your tonsillar lymph nodes, submandibular, and your submental. And then I'm going to try to feel for your superior clavicular lymph nodes, and then your posterior cervical lymph nodes, and also here, let's undrape you so we can get your lymph nodes a little better. And we're going to feel for your clavicular lymph nodes down in here. All right. Now let's move on to your trachea. Go ahead and just take this down just a tiny bit. Go ahead and turn your head to the right, to your left. Go ahead and look straight up. Go ahead and look all the way down. Bring your chest all the way down. Good. Go ahead and shrug your shoulders. This is checking cranial nerve number 12. Go ahead and push against my head and push against my head. Very good. And now I'm going to check your trachea. Go ahead and lift up your head a little bit. I'm gonna have you try to swallow. Good. Here, if you'd like some water, go ahead and take a sip and then swallow again. Good. I'm just gonna feel these bones. Go ahead and lift up your head more, please. And go ahead and swallow. Good. And make sure your trachea is where it's supposed to be. Good. Right there. Very good. And now I'm going to palpate your thyroid. I'm going to have you take a sip and hold it in your mouth. And I'm just going to displace it right over this way. And then when I say swallow, I'm going to have you swallow, okay? Go ahead and swallow. Very good. And then we're going to do the same thing on this side. Go ahead and swallow. Very good. And feel anything? That's good. I'm going to check where your thyroid imus is right here. I'm going to have you swallow one more time right here, okay? Go ahead and swallow. Good. Very good. Next, let's move onto your carotid. Let me feel for your carotid artery. So for that. Good. Just gonna feel for that. Good. And I'm gonna listen with the bell for any whooshing sounds. My stethoscope. Good. Very good. All right, now let's move on to your chest. I'm gonna undrape you, okay? And we are going to, I'm gonna take this off all the way so I can see both of your chest. Now just breathe normal like you would. I'm just gonna look how your chest is rising. Good, go ahead and sit on the edge of your chair and continue to breathe. Very good. I'm just gonna palpate for symmetry on here. Make sure everything is good. Good. Slowly back. Everything is good. Go ahead and lean forward for me a little bit. Thank you. Okay. Very good. Now I'm gonna have you lean forward, and I'm gonna have you, don't lean forward too far, just lean forward a tiny bit. You can sit up, and I'm just gonna have you breathe normal. Just checking for, make sure it's expanding. Good. Now I'm gonna do the same in the front. You lift up your breasts for me a little bit, please. Put my hands right here. You can relax, and then just breathe. Very good. Good. Now I'm gonna palpate for vibrations. I'm gonna have you say 99 in a regular voice, and I'm just gonna feel on your chest, okay? Say 99.
99. 99. 99. 99.
Very good. Get on your back now as well.
99.
Go ahead and lean forward a little bit for me, please.
99. 99. 99.
Very good. And now I'm going to have you cross your arms in front of you like this and lean forward. And I'm going to percuss your back and your front, okay?
Mm-hmm.
I'm also going to percuss the sides of you to see if you have any tenderness right here.
Okay.
Very good. Now I'm going to percuss the front. Relax. And I'm gonna have you just lift up your breast just a little bit. And on the other side. And I'll have you lift up your arms a little bit and I'll percuss on their sides. Very good. And one more over here. Very good. Now I'm going to listen to your lungs in the same kind of order, and we'll do lateral coming back, okay?
Okay.
Go ahead and just breathe nice and deep and slow and deep for me. Go ahead and lift up your arms. Good. Good. I'm gonna listen to your front now. I'm gonna have you lift up your breast and put this in. Very good. And your AP diameter, which measures your back to your side, is 1 to 2, which is normal and looks good. I'm going to have you lay on your back now. Over here on this side, your head down there. I'm just gonna inspect your heart, see if I can see anything. And I'm going to also palpate right here. Here. Palpate right here. Just feeling for any beats that feel like they're jumping out at me or any rushing of blood underneath. Feels good. I'm going to now listen to your heart. I'm looking at your veins too, and your veins look good so far. Carotid and jugular vein. And I'm going to listen to your aortic valve, your pulmonic valve, to your tricuspid, your spine, your mitral valve. I'm going to listen again with the diaphragm. good. I'm gonna have you now lay on your left side. I'm gonna do the same thing again. Very good. Very good. I'm gonna have you sit up now. And I'm gonna have you lean forward just a little bit. One last time. Okay, very good. And that'll conclude our assessment. Thank you so much, and thank you all for watching.